Topic: non-smoking lung cancer. Since the recent death of activist Dana Reeve, this issue is making headlines. Joining me now is Dr. Michael Jones. Dr. Jones, thanks so much for joining us.
Well, thank you for having me.
Dana Reeve, Christopher Reeve's wife, was only 44 years old and died of lung cancer. Never a smoker. How often does that happen?
Well, it's actually very uncommon. Cancer in non-smokers is actually very rare. There are other causes for lung cancer, other predisposing causes. Some of them are genetic and inherited. Some of them are genetic and acquired. And then some of them are environmental.
And by environmental, could you also mean secondhand smoke?
Secondhand smoke and radon exposure.
With secondhand smoke, what is the death rate among those who didn't smoke but were exposed to secondhand smoke?
Well, the risk of exposure to secondhand smoke is entirely governed by the degree of exposure, and there are mechanisms for measuring that.
So if your spouse smokes a great deal, or the person you live with, or your parent or whatever smokes a great deal, your exposure in that sense can be greater or less.
Yes, and I think the most disturbing thing I've read recently is there was a study from England in which they looked at secondhand smoke exposure in children, and actually they found that the risk of developing lung cancer in adulthood was higher.
Another good reason for parents not to smoke around their kids. Research shows more non-smoking women develop lung cancer than non-smoking men. Why is that?
Well, that's often quoted, and I've seen that in print in some magazines recently. But there have been two large studies recently, one from the U.S., one from Texas, and one from the Netherlands, and they show that the lifetime risk of developing lung cancer, even among never smokers, is still higher in men than in women.
What are some of the symptoms of lung cancer?
Well, the most common would be persistent cough or recurrent pneumonia that failed to respond to treatment, blood in the sputum, or unexplained chest pain.
What advice would you give to non-smokers and how they can make certain that they don't get lung cancer?
Well, I think for non-smokers, the thing to do would be to focus on the second most common cause of lung cancer, and that's radon exposure in the home. And both the US EPA and the NCI provide booklets that are free to the public to tell you how to screen your home for radon exposure.
Thanks so much for joining us.
Thank
you. Great
information.